welcome to this morning's Health Spaces. We're really excited to kick this off with a discussion and some very esteemed panelists that are going to help us navigate through some of the challenges and what the state of the healthcare industry is today and looking forward. So with me today, I have Andy Woommavovah. If you could introduce yourself, Andy.
Sure. Good morning, everyone. I'm Andy Woommavovah. I'm the Vice President of Facilities, Construction, and Sustainability for Trinity Health. Been there just a little over 2.5 years. I moved over to Trinity from Common Spirit Health, which is a company created by the merger of Catholic Health Initiatives and Dignity Health. For 3 years there, I led the Energy and Infrastructure Program, and then prior to the merger, I led Facilities and Construction for CHI, so I got to be part of that kind of mega merger planning and programming. Happy to be here.
Thank you, Andy. We also have with us Vinny Grippo. If you could introduce yourself, please.
So Senior Vice President for Enterprise Services, started with Northwell Health about 2.5 years ago. Have responsibility for real estate facilities, change management, project management, and a group called Flex Staff that does our temp staffing to help support staff shortages in hospitals and other functions across the health system. I actually came from 20 years with the City of New York in various capacities, but for the last 9 years with the police department managing their budget and facilities. So it's a change for me to be in healthcare. I've been really an incredible experience so far, and looking forward to hopefully many more years in healthcare.
We're going to pull out some of Vinny's experience from NYPD and working in the City of New York, so this is going to be good content. All right, Jesse, would you like to introduce yourself?
Yeah, thank you. Jesse Balok, Vice President of Campus Planning and Operational Integration for Henry Ford Health. Been at Henry Ford about 2 years, came with 20 years experience on the other side of the table as a consultant doing facility planning in places across the country, a little bit overseas. So my background's a little bit different than the typical project lead. I've done everything from strategic planning and market assessments all the way through master planning and programming and design and through activation of new facilities as well as process improvement initiatives. So right now I'm leading our project that we call Destination Grand, which is the rebuilding of our Detroit campus, which is the original Henry Ford Hospital from 1915.
And just a little bit about myself. I worked for about 2 decades for healthcare organizations and ran facilities and construction. Was fortunate to have an opportunity to move to the other side of as some people say, the dark side, but to the vendor side of the world, and have been working in the controls space for a little over 10 years. So really excited to have this opportunity to speak with you all today. So we got together in preparation for this and tried to boil it down to just a few topics. And interestingly enough, the topics that we came up with were very similar to some of the topics that were discussed last night by Nick Webb. One of them that he didn't really cover is aging infrastructure. And HFM Magazine recently did a survey and came up with 47% of all mechanical electrical equipment is way beyond its useful life. And so the challenges around aging infrastructure, Andy, how do you obtain capital for that? And what strategies and processes do you have in place to be able to manage the aging infrastructure?
This is, in my opinion, this is probably by far one of our biggest challenges in healthcare. Facilities doesn't generate revenue. So we have to compete with the Da Vinci's, the MRIs, the CTs. And we don't win that battle, but they still purchase this modern equipment and they want to plug it into this really old infrastructure. So it's become a challenge for us to be able to compete for that capital. Now at Trinity, we're fortunate. We've got about $50 million a year we put in an infrastructure pool, right? But that's really kind of like shooting a BB at a freight train coming right at you. It doesn't do a whole lot of good, but it just kind of gets us through critical failures. And then it's all about kind of managing that. When I came over from Common Spirit, we had a similar program where we would submit projects and then it would be evaluated by a committee on the greatest need. But the challenge with that is everything is the greatest need, so we have to figure out how we're going to fund that and look at alternate ways to fund the infrastructure. But it's really important to understand what it is, what it looks like. So having some type of system, whether it's a system CMMS or some type of automation system that's going to be able to tell you what your assets are and be able to inventory that.
Sounds like you have a lot of work ahead of you to get to where you need to be.
It's definitely a challenge. Sometimes we're our own worst enemies because our facility professionals, they're very good at maintaining their equipment. We've got very good support from our vendor community. So we're able to kind of extend the life a second and third time of this equipment.
And Vinny, having come from where you're managing a lot of assets for the City of New York, how are you managing now for Northwell Health? How are you managing the aging infrastructure there?
Yeah, so I mean, it's interesting. When I worked at the police department, we had our buildings effectively built to sustain, and whatever kind of disaster is hit, those buildings are going to stay operational. They're running on redundant emergency power. They run as though, on emergency power, as though every function in the building, it's seamless. You don't realize you're on emergency power. Having made the transition over to healthcare and seeing what we experience in the hospitals. Our hospitals, based on, they comply with New York State code. Unfortunately, that doesn't include redundant emergency power. Unfortunately, in many instances, when the utility power is out, we don't have sufficient cooling to operate certain functions in that hospital. We shut down ORs. We're not doing elective surgeries. And that has a major impact on the place. So we are looking at, how do we make our tier 3 hospitals in particular more redundant, resilient? How do we increase the capacity on emergency power? And this is a huge challenge. What Andy said, we have 23 hospitals. We have 1,000 sites. To give you a sense of how large Northwell Health is, we're growing and adding another 7 hospitals next year as we acquire Nuvance. And we've been spending about, it's somewhat embarrassing, 30 to 40 million on infrastructure per year. There have been years we've been allotted more, and when I got there, just looking at the amount allotted and the amount spent was a real concern to me. I think part of the challenge is the teams I have managing these projects, as I think you all can imagine, get a lot of pressure from the operations folks for the growth capital initiatives. And those growth capital initiatives tend to move because the pressure's on. I think we were neglecting the infrastructure projects, and the way we were funding these annually meant if we weren't spending the money, it resets, a new pool next year. And that just means a lot less projects are getting initiated, which puts us further and further behind the 8 ball. So we've started to dedicate resources to infrastructure, project management. We have those resources reporting to the chief engineering officer. And we've also started to take, we used to really be in receivership in terms of the projects get requested by the hospitals. We then assess them, and we'd reject or approve based on does it meet certain risk stratifier. But we've now started to take back control and in some cases initiate projects the hospitals aren't asking for. Because again, the operators might be prioritizing additional parking over critical systems. And we have to balance that and make sure we're getting that infrastructure dollar that we are spending in a given year, we're prioritizing the right things.
Jesse, I'm going to hand it to you. You're facing some of the same challenges we all are. And one of the things that you talked about that was you have a different approach for different facilities. Do you want to elaborate on that and some of the other challenges and how you're addressing aging infrastructure?
Yeah, I mean, as I mentioned earlier, we're a pretty old facility to start. Our 1915 building that Henry Ford himself worked to commission is still in operation. It's no longer accepting patients, but our 1920 facility is. And we still have a significant portion of our census in that original structure. So not to disparage all the great work that everyone does, that I keep thinking of all the list of leaks and everything that we're dealing with on a regular basis. One of the ways that we've had to address that as we're looking at this project to redevelop the hospital in Detroit is that we're building a new central energy hub to do that. We cannot do what we need to do in the existing infrastructure any longer. We do spend millions of dollars every year doing that, and the team does amazing work. So one of the things that we've been looking at is, as you're entering into a project and looking at a multi-billion-dollar effort, what are the things you can do to maintain that resiliency that people go to you no matter what? So you need to have that 100% uptime. You're that beacon on the hill. Being in Detroit, there's over the last several decades, a lot of the individuals in the area have had fewer choices and places to go. And so we're left with that challenge of how do we continue to function in an aging infrastructure, but also looking at how do we create this environment of seamlessness? How do we look at new energy sources? How do we're going to talk about sustainability later, but how do we do that in a way that reduces our carbon footprint? So we've got actually two plants, one that recently opened at one of our facilities, the one that's being built here, breaking ground in the next several months. And so ultimately we have to then come back and look at what is this, how do we address the legacy side of things with some of this newer technology and the monies that we are able to spend. We're fortunate to be able to do that. So we're kind of in a rebuilding mode right now and understanding that we can't continue what we've been doing for the last several decades.
Yeah, Renee,
Just-
just a
oh,
couple
go
of
ahead.
quick comments there. And Vinny and Jesse talked a little bit about this on, getting that capital and how do you carry that message and who will listen to you. Prior to us coming together when I was at Common Spirit at CHI, part of that merger work was for us to do facility condition assessments in all of the CHI hospitals, which was a blessing in disguise because what we discovered is, one, we were able to inventory all of those assets and understand the replacement costs. And what we saw was this huge backlog of capital investment. And we use that message to the senior leadership for them to now see what their impact really looks like, because you have really solid data and you can go back to this information and help that to carry your message on why it's so important to replace this infrastructure.
And then you're able to create the business case around how that ties to clinical outcomes, clinical capability to treat patients, and revenue. If it doesn't tie to patient revenue, they're not going to listen, correct?
That's right.
Yep.
And if you can connect it to revenue impact, if this air handler goes down,
That's right.
this is the dollars that's going to cost the hospital in revenue.
That's right.
Yeah.
And Jesse, you mentioned something that I want to dive into a little bit deeper. You talked about this mega project, and some of the things that we're seeing now is years ago. So this is early 90s. I was in charge of a new hospital project, and our biggest conversation and what we discussed was inboard outboard toilets so that the patient rooms could eventually all become ICU rooms. So we were talking about this in the early 90s. I was in that hospital recently, and those patient rooms still are not ICU rooms, but we're still talking about that.
Yeah.
And as you're looking at your mega project, Jesse, you mentioned that as well.
It's amazing how much you talk about bathrooms. We're building a 432-bed hospital with 2 floors of procedure spaces, 50 big box rooms, 100 treatment spaces in our ED, and we talk more about call rooms and offices and bathrooms than you would expect. But that is kind of the project is, we spent a lot of time with our nursing leaders early on, understanding if we really are going to be the tertiary quaternary place in Detroit, we are the designated site. If there is, elected officials in the area that would go to, how do we not only care for what we know is coming, but what we don't know? So some of that comes with adaptability and flexibility in the design. We did go outboard. The idea was we want the clinical team to have an unobstructed pathway to the patient as soon as possible with visibility. Every single room in our tower is built to be ICU capable. So it's built on the FGA guidelines for ICU. We're outfitting about half of the units as ICUs and have other units that are immediately transferable and capable to go to that setting. This carries throughout. It goes into air exchanges and how do you create an environment that allows you to have 100% outside air in the entire ED, or for certain we're doing it within our ICUs, but are there other areas that we want to be able to go beyond just the air infectious isolation rooms or other contact precaution rooms, and create an entire environment for, you know, it's the question of, if everything happened like it did when COVID happened, what would we do? And then it's, well, we know it's probably not going to happen like that. So what are the other things that we need to be looking at? So we're dealing with all of those things, and the question comes down, as we all know, is these cost money, and it becomes a conversation with the leadership team about this insurance plan. How much do you want to spend on those things that we think might happen, and how much are you willing to spend to afterwards say, I'm so glad we did that. In my former career, we spent some time planning other facilities that were well positioned to be the ones that people went to because when COVID happened, and so they had the infrastructure, they spent that money. And so we're having a lot of those conversations now. We're coming out of DDs, have made a lot of decisions. I'm hoping they all stick all the way through, because there are obviously budget conversations. But it's the kind of thing that you really have a hard time doing unless you're building something from scratch, in my opinion. It's really hard to retrofit to get to these things. And so you make a concerted effort, spend a little extra time now, and I don't like future proofing necessarily as a concept, because we want the future to happen, but we just don't know what it is. So we're trying to create as much opportunities for adaptability as we can.
Well, and Vinny, when we were prepping for this, you don't have any mega projects coming up, but you have complexities and issues around how do you balance your ambulatory facilities, consolidation, growth. Do you want to speak a little bit about that and how you're working on balancing all of that?
Yeah, well, I'm sure a lot of with the changes going on in the retail real estate market, you're seeing these opportunities as we are. And, on the real estate side, I think as a health system, we are in some ways trying to figure out which direction we want to go in. There's a lot of pride at Northwell Health in being the mom and pop health system, the local health system that people go to. They're comfortable in the practices right around where they live. But the big box thing in our market is a big deal, and we're seeing our competitors migrate to big box locations. We have some health systems knocking on our door that are acquiring some of these locations. They're capital intensive, as many of you know, and we on the real estate side are working with the operations folks. They're building business plans, trying to justify acquisition of these properties and the capital needed to build them out. And one of the challenges that I think we're facing is that balance between growth opportunity, consolidation opportunity. How do we look at the existing real estate and not have every acquisition be growth? Because on the bottom line, on the expense side, that starts to pile up on you. How do we find those opportunities to consolidate in, to get out of some of the leases that aren't strategic? And what I found we had to do to really start to advance those conversations, and we still have a lot of work to do, but our data was so siloed and really, and frankly, in many cases, just not the level of quality we needed. We went through a many months effort to build a BI tool that effectively consolidated ambulatory data with our lease data, with the data we collect on the quality of the properties as they align to patient experience standards. We brought in Press Ganey. Now we're moving to Perceptics data to see what the patient experience is like from their perspective. And by bringing all that data into that one BI tool, we're starting to see the operators get, real opportunities to drill down, and they can see what the real estate portfolio they manage in a particular submarket, what it costs them to manage, what it costs to manage those buildings, what the experience is in those buildings. And that is helping inform the strategy around, here are the big box opportunities. Let's get some of the programming out of some of these facilities and migrate it over. And we're still within that big box going to have some growth as we, have some room in that space for additional programming that we feel we're not strong enough in that submarket, and we need to increase the number of doctors that have that particular specialty in that location. So,
Well, Andy, you've just taken over and you're developing a national program for Trinity Health. How are you managing your portfolio and what does that look like?
Well, so when Jesse and Vinny were talking about kind of the work that they're doing, I feel like they're probably 100 miles ahead of us. And what I mean by that is just the data that Vinny mentioned, right? Trinity's a pretty large organization, so if you've seen one Trinity hospital, you've only seen one Trinity hospital. We're still kind of in that, my opinion, we're still kind of in that holding company mindset instead of the operational mindset. We're not really good at pre-construction estimating for initial project budgets. We don't have a platform. We do anywhere from $1.5 to $2 billion of construction a year, and that's either projects in design, projects in flight, projects finishing up. We're managing in smart sheets and spreadsheets, right? So we're the size of a mid to large size general contracting company, and we don't have a system look at the data yet. We don't have really good processes in place. We're moving there though. So the last 2.5 years, we've RFP'd for a CMMS platform or RFPing for a construction project management platform to be able to see ourselves as a system and then overlay standards. So we're always kind of restarting projects. We don't always do OPR on our projects. So we're taking kind of a step back to understand what's the best place to start so we're not recreating projects every time we go after them.
Well, and we're gonna move, actually, we've got a lot to discuss still, and I'm seeing the clock tick, and we wanna make sure that we're leaving time for Q&A at the end. So one of the other major topics that I want to pivot to that we discussed and I think was consistent across all organizations is recruiting and retention of staff. And again, that came up last night in Nick Webb's talk. So Andy, you're doing a lot around that and really creating some tools and some processes for that. Let's elaborate on that a little bit.
Sure. So every year hospitals do, or semi-annually, they do surveys just to understand how employee engagement's going. Historically, on the facilities and construction side, there's never been a whole lot of technical type training available for those technicians. We get the things through HR, leadership, supervisory training, but we don't get that technical training, and that's what they ask for. So if you want folks to stay engaged, you want to give them what they ask for. When you train them to move up within your company, you're just growing your own crop, and you can always choose to bring that entry-level person in from the outside. It's very hard to come into healthcare and just really start operating. One of the things that we did is we engaged with a really great partner. We created this learning management program. It was an LMS learning management system, and it was capable of developing transcripts, programming, training for the employees. And at Common Spirit, they're taking that move and continue to move that forward. That's what we want to do at Trinity. So all of the feedback that we've got, we're about to launch our national program for facilities and construction. The number one piece of feedback that we got from the field was, we need training for us. And I think what that does is when you start to grow that crop, when these folks are starting to retire and you're having these vacancies, you're able to bring folks up in. Right now, when some of these senior folks leave, there is tons of institutional knowledge that go away with them just because we didn't have a great opportunity to kind of start that backfill. But we have that vision now and strategy to move it forward.
And Jesse, you had a lot to say about that when we were talking last night. Do you want to share some of your insights on recruiting or retention?
Yeah, I mean, we're probably not that unique in places across the country, but Detroit's been in a population of decline since the 1960s. This is the first year that we're going to see some growth in actually the Detroit metro area. That comes with it challenges of finding the right people with the right skill sets to do the work that needs to be done, and it's across the board. It's in our operating teams as well as in the trades and that, and I can talk more about that later, but I think the thematic that drives a lot of our recruitment now is change, is the opportunity to transform, and that's scary for a lot of people. A good portion of our staff have worked nowhere else. I still talk to people and I'm like, oh, I'm new. I've been here 2 years. Like, oh, I'm new too. I've been here 15 years. And you're like, okay. But we have some people at 30, 40 years. And that comes with, that's part of the culture. That's part of how we've retained people in an environment that has been challenging. But I think we're starting to see some of that energy and enthusiasm because we're not talking about just doing what we've always done. And that's in some ways part of I think why I've created mostly friends, but some enemies in the process of why can't we do it this way? Well, we've never done it that way. Like, this is the time for us to do that. When else would we do this? And when else would we think about changing the roles of who moves this to there, or changing the way we think about the patient experience, or changing about the way we do rounding? So we've started a lot of processes now, talking about change, looking at how do we reduce length of stay, how do we change rounding, how do we do certain things in our existing spaces that normally I wouldn't start that transition planning conversation until 2 or 3 years before we move into the new building. But we have capacity issues now. We have retention issues now. We have all the normal issues everyone else has. So we're starting that early, and we're starting to see some of the change in culture happening. And I think that comes with retention. It comes with seeing new ideas, maybe asking people for input where we haven't been able to respond to that input and actually put it into play. So that transformation comes out in a lot of different ways, and I think it's going to continue to raise the boat for us.
Vinny, I'm not leaving you out on this one because you are literally the poster child for this. You came from another industry. You came from the city and the fire department in New York. And so, how is your perspective coming into the healthcare industry and how you're recruiting people and where you're looking for talent?
Well, I'll say what Andy said earlier about we struggle to when I get out and do focus groups, or I talk to the different groups we manage, and they all feel for many years it just haven't been the development opportunities, the career development opportunities, the training opportunities. And from a recruitment standpoint, we've really struggled. I think we're fortunate in one aspect. We do have good employee retention rates. People do tend to stay quite a good amount of time with Northwell. I think that's we're in a weird market, so all the people who live out in Long Island who don't want to commute to the city find working at Northwell to be rewarding in many ways. But we have to do better. We've got to really develop their careers. In terms of recruitment, though, we struggle. And what we've really done recently, and a number of the people that we've brought in that have done very well don't have healthcare experience. We're effectively looking at the development. The development industry in New York City is just changing dramatically. There isn't a lot of development going on where these firms are chock full of talent, but they don't have projects to work on. So we've identified some people, who have different experience. Development firms, they're building big residential towers or big commercial buildings in the past. And what we've done is paired them up with people who, from my view, aren't ready for the next step, and that's why they're not getting the opportunity and why we're recruiting out. But they're people who've been with the health system for 20 years. They really understand the projects, they understand the regulations, and that's worked very well. We just have had remarkable success in 2 of our regions where we've had a veteran to pair up with someone from a different field, and we've seen just remarkable progress. But it's a continued challenge on recruitment.
Real quick, one of the things that we're trying to leverage as a tactic is technology. So building automation systems when you can modernize, and instead of a person walking to a piece of equipment, you can monitor it remotely, and you're changing filters based on pressure and not on calendar.
Or fire alarm systems that self-test, all this technology that Nick was talking about last night, and how do we implement that to make our teams more efficient. So
Yes.
we would be remiss without getting into our last topic, which is probably, I think, Andy's most passionate thing that you talk about. I've heard you talk about it, which is sustainability and decarbonization. We are still moving in the direction where we need to look at this. It needs to be a focus, and it is becoming more and more apparent that we can't ignore it anymore. And so I'm going to have each of you talk just briefly about the goals for your organization. Do you have sustainability goals? And if so, what are those? I'll start with you, Jesse.
Yeah, when we first agreed to rebuild, I wasn't aware that we had decided that we were going to be carbon neutral by 2040.
It's surprised.
And
Surprised.
that changed a few things, especially the dollars we had allocated for our cup. Um, so we did go to the White House with several others in the country and sign a pledge. And um, the Central Energy Hub now, as we're calling it, is a big part of that, getting us to basically an all-electric hospital, um, which also means when you talk about some of the challenges with that, it means you're not having gas cooking stoves in the kitchen and other things. So the chef wasn't really excited about that to begin with, but so we've you start with, I think, very ambitious goals, and we're heading full force towards that, spending a lot of money to put a all electric energy hub. We are looking at reduction of our landfill. We are looking at change in the materials that we're using in the building process. But I think one of the biggest challenges for us is that there's a certain culture that goes along with that. So we have these institutional goals, but we still have problems with compliance for recyclables at the point of use. And so while we have these conversations about all the things that we're looking at, and we're looking at biodigesters, and we're looking at other different means of renewable energy sources and that, we need to start changing the culture. And some of that goes to our providers that help us picking up the materials and where it goes. And so it's a much bigger conversation than just the technology we're buying and how we're designing the building to allow for certain things. That we're implementing a pneumatic chute system that will have recycling and linen and trash separate, that allows for all the things to happen. But we still need to get a culture that believes that that's important, and it's ingrained in the everyday. And so we're kind of coming at it from two different directions, top down and bottom up right now.
Vinny, do you have goals for Northwell Health?
So Northwell 2030, our goal is 50% reduction in greenhouse gas emissions. As I said when we were preparing for this, the city regulations for our hospitals that are in the city will require us to go further. 2030, there are serious limits that frankly, we're going to struggle to meet, and it's going to end up costing us, if we don't meet it, about $10 million annually in fines because of the way the local law is drafted. So we're doing a lot, as I think many of you are, right? Retro commissioning. We are doing solar farms where we can and incorporating solar. We're purchasing hydropower. We're converting oil burning gas to natural gas. But the bottom line is, I think what we really have learned from this experience is you have to look at each facility individually, and you really have to develop a plan for each facility that works because of the challenges we spoke of earlier on the infrastructure side and the dollars available. You just have to look at what the opportunities are at that particular site. So we get people who get very excited about green roofs, and then when we look at the site, the amount of work and the investment that would be needed doesn't make that really a feasible option, where we have hospitals right next to those where we've got tons of land to do sustainable organic farming that's going to come at a very low cost and be more operationally functional. So we're going through that process and looking at what works for each site. We have done, we're at about 23% of the 50% goal in reduction. So we've made significant progress, but a lot of work still to go.
Andy, you have been speaking about this nationally. You've been on a lot of panel discussions, and so I'm going to let you take this home for us and talk
Sure.
about what your work in this space.
Well, so my experience here, I kind of relate it to being in a speedboat and being in a paddle boat. So when I was over at Common Spirit, we were in the speedboat. Common Spirit engaged early. They participated. They brought the third party in to help us understand what our corporate footprint looked like, and then the accounting inside that. Now, when I go over to Trinity, it's like when I'm interviewing, I'm asking all these questions about decarbonization and sustainability, and they were just like, what are you asking all this stuff about? So Trinity hasn't started a program yet. We're conspicuously absent from that list of major not-for-profit healthcare organizations that have opted in for goals. You know, a 2030 goal is less than about 5 years away now when you look at the years and the months. When I started asking questions, Trinity, the senior leadership there, they opted to focus on their resources on providing the patient care, which is absolutely not a bad thing. But now we're starting to get these pressures, right? Joint Commission, SEC, CMS is thinking about doing some things. So we're starting to see these pressures. Vinny mentioned what the states are doing, so that's more direct pressure. So leadership said, all right, we need to get moving. And I said, okay, what is the first thing that you think we need to do? And they're like, well, I don't know, you tell us. So I said, we need to establish what our boundary looks like. We need to understand what our corporate footprint looks like, and then do the counting within there before we state our goals. Because a lot of times, you know, you opt in for goals and you don't necessarily know exactly what you're going to do. And Trinity is a pretty large organization, so just understanding where this data is coming from to understand how we can categorize it in our scope 1, 2, and 3 of our emissions. You know, scope 3 is always the largest, so it's usually like a 70-30 split between 70% of your total greenhouse gas emissions are in that scope 3, and 1 and 2 is kind of split. But just understanding all of the data streams that come in to allow us to start to do, one, the corporate footprint, and then the accounting has been a huge challenge. I call them business partners that are within, you know, the company on who's going to help us find this data. I'm at 32 now, 32 different business partners within Trinity to help feed this data. And then we got to hardwire that in. But what do we hardwire it into? What platform do we use? You can't do this in a spreadsheet. It's very complicated. I mean, you could. There are a lot of really smart people out there that would probably have no problem doing that. I would. So we have to understand what kind of platform we're going to use to manage the data, to be able to tie it to our goals, show us our progress, and then, as important, provide this real-time reporting to our senior leadership, because they're going to want to know what we're doing. And we've got a lot of folks that are out there within the Trinity Health geography that are doing really good things. And Benny mentioned retro commissioning. So everything we do on the facilities and construction side, we're thinking about that decarbonization, you know, future. So we're thinking through how we're doing things. We're doing the retro commissioning. We're making sure everything that we do now is expandable. We're establishing energy design standards for our new projects. Even though we don't have goals, right? It's still going to be tied to that base year that you pick. So we're probably going to be somewhere within 16, 17-ish. That's when Trinity really started growing. Also, there's been some mergers and acquisitions that have occurred. So that's a really good spot for us to kind of tie our baseline to start to measure our goals. We're doing a lot with the way that we're procuring energy, natural gas, electricity. We're looking for, you know, greener options. We are doing solar projects. We're looking at fuel cells. We're looking at anything that we can implement to help us reduce that.
And are you able to start creating that culture of sustainability? Because that's really the foundation of sustainability for a healthcare organization. If you don't have that culture and you don't have, as Jesse said, that top down and the bottom up to bring that culture together, it's not successful. So are you working on that, and how's that going?
We are. It's kind of informally, right? I say it's kind of managing by influence. What we're finding, and there are a lot of folks out there that are in the hospitals that are really engaged. They just want to know how they can participate. So we're launching some surveys to understand who's doing what. I've been having one-on-one calls with some of our facilities out west, and they're already doing a lot of really good stuff. Now, the leadership, I think they're all expecting it. It's kind of like they're bracing for some kind of impact because they know we're not doing anything yet. And they're asking questions, right? They're asking really good questions. They want to get educated. And we've created just kind of some decarbonization education slides for senior leaders. You know, ASHE has a lot of really great resources. So anything that we can provide them to allow them to understand, they continue to get the engagement.
So I wanted to make sure, thank you, Andy. I mean, that's just a lot to unpack, and you've got a lot in front of you, and the contributions that you're doing nationally for that is amazing. So I wanted to make sure we left enough time for Q&A for the audience. So we have about 10 minutes, and I'd like to open it up to questions. And if you don't have any questions, we'll continue on and talk a little bit more about sustainability, but I'd love to get some questions from the audience. And I can't see out there, so we can't see, so I'm going to need some assistance.
I'm over here. Thank you so much. On the sustainability, because HealthSpaces have so much food in them, I'm wondering if you're doing any composting and how you're partnering with people for that. Thank you.
Jesse,
We're evaluating so one of our hospitals is as you described, it's out in more of a bucolic area. It has the gardens and all that stuff and is already doing a lot of these things. In our downtown setting, we're looking at a biodigester as something that would be probably more after the fact sorting of things. We're looking at other things that might accommodate roughly accomplish the same thing. I think there's some challenge to that because the question is always it helps with the reduction of what's going to the landfills, but how do you use it? How is it deployed? We are lucky enough and have participated in some kind of community farming, even in downtown Detroit, where could be a possible outlet for some of that. There are, a lot of other things that we can explore. So we're early on in the process, I would say. We're right now a 5-hospital system, 300-ish locations, and so each organization still has their own kind of culture within it and how they're able to embrace all these different aspects. So I'm hoping that we can come up with a good ROI on this and make sense. In many ways, it's about sending a signal to the community as well. And we're doing this, and we think this is important. And in many cases, educating some of our patient population that might not be as exposed to some of the opportunities. So.
Vinny, do you have anything to add to that on how you're addressing that?
All I can say, we actually hired someone. I'm lucky I work for a health system that likes to hire people from the public sector. It certainly helped me out. We hired someone from the Department of Sanitation to look at this for us. And it is something that we're trying to incorporate into our long-term planning on organic farming, sustainable farming, and then composting. But I think one of the things that you said earlier, the challenges on just getting compliance for recycling programs, there's a culture change that needs to happen at the sites to support these things. And so what we've done, I think I'm fortunate. Our CEO participates biannually, sits on top of a steering committee that then meets quarterly, that has a cross-section of leadership across the health system, totally focused on sustainability. And so there's a lot of support top down on these initiatives, but we still have some work to do at the sites to really get compliance on some of the basic programs we've rolled out. That's really important.
So is composting, and is that on your radar, Andy?
It's not immediately on the radar, but it's part of the program and the vision. Like I said, we've got a lot of folks out there that are doing some of these things already, and we just haven't started keeping score yet, but we will be.
And I know that one of the projects I worked on, we actually designed the food service to have that capability. The challenge that we had at the time, and this has been 10, 12 years ago, was that getting the composting service to somebody to take that within the community was the big hurdle. We were going to move to all compostables, and we had the composter in dietary and everything, but then taking it from there forward was really the challenge. Josh, I see you have a question.
Always.
Always.
Josh Brackett with Banner Health. So this is actually a coupled question with infrastructure and sustainability. So a lot of hospital systems are struggling with infrastructure, as you say, right? So, and what we see is when we do get infrastructure funding, it's a like-for-like replacement often, right? So like a constant volume to a constant volume. So have you had any success, or do you have any tactics where you've been able to leverage sustainability to decrease the energy cost by allowing for newer technology instead of continuing the same issues that we've faced?
So I'll take a first run at that. Josh, what we started to do is look at systems instead of equipment and identify them as part of the system. And what we've been able to do is a couple of things. Is that message now changes from like to like for a system because it's kind of connected to these things. All the age is all the same. There's an education piece that needs to happen there to educate the leadership that's looking at this. That hey, this is a like for like, but these other parts and pieces all are part of the system. The other thing that we're doing is, as we look at doing our master facility plans, we're anchoring kind of condition assessments to that, so that when they do a master facility plan, they have to go out and look at modernizing this equipment. Now we get to kind of pin that little sustainability decarbonization star, because we've started communicating in a different language now. You know, it's equivalencies. Well, we're taking this many cars off, this many trees, we're saving this much gas. That's, to me, that's the vernacular that we have to start putting out there to the leadership. They're starting to understand it. And from our guys, the folks in the field, the facility directors and managers and technicians, they've already been doing this energy efficient thing, but they called it something else. So it's a combination of educating them on what we're doing and then thinking of things now as systems, because we have to be efficient in the systems to be able to move forward for carbon reduction.
Jesse, do you want to?
The jury's out on the actual cost savings. We've run the numbers and looked at all the things, and it does come with some significant upfront costs as we're looking at triple pane glass and looking at heat capture. And I'm not an engineer, but I can say adiabatic, but I don't really know exactly what that does for humidification. But we're looking at all of these things, and they do come with some sort of benefit. It's just, we haven't even broken ground yet, so it's going to be a long road.
Vinny?
Yeah, I would just say the local regulations I spoke of earlier are really helping us move the leadership from replacing kind to, when we have the opportunity to make these investments, we have to ultimately incorporate more sustainable infrastructure. So, we've been doing that on most of our projects. Our limitation, we had a couple of major plants that we replaced as a result of Hurricane Sandy, believe it or not. Seems like that was so long ago, but that's how long these projects take. And with those, we had to do a lot of replacement in kind, and there's some challenges there with the plant we developed because of that, the FEMA restrictions. But for the most part, we've really moved to upgrading.
Renee, there's this kind of emerging concept about the cost of carbon. So there are a lot of conversations out there to start also to connect the cost of carbon to these projects. The facility leaders or the finance leaders, they're not really ready for that conversation yet. But the more and more we get into mandates, the more and more we're going to be able to start to bring the concept of the cost of carbon.
I think we have time for one more question.
On the back there.
Good morning, everybody. Patrick Burke from Columbia University Medical Center in New York. Vinny is a fellow New Yorker and manages a similar type of portfolio to what we have. In New York City, in New York State, we've got a very aggressive sustainability measures, Local Law 97, we call it, which is really extraordinary. Perhaps your shared perspectives sort of on where we're at as it relates to transitional technologies. We've talked a lot about decarbonization of heat sources and hot water and cooking sources and so forth. Today, we're sort of in the land of the fax machine, if you will, before the PDF of how you make hot water that's going to, keep places, hot up in Michigan and in New York City and around the country and so forth. So it kind of goes hand in hand with a big conversation. We're kind of coming full circle on the conversation of these are our aspirations, but is the technology really there? And when is the time to really make the right investment? So your perspectives would be very helpful.
I'll take the first. So we're kind of still into becoming this operational company, but what we're going to be doing is, for the lack of a better term, we're going to be having some design contests with engineer firms and architects to let them come tell us how can we make ourselves better for the future of this decarbonization and still kind of accomplish the goals of cooking food and heating and cooling the buildings in the most efficient manner. So we're gonna more to follow on that one, but it's I'm gonna have a design contest and we're gonna see who wins.
We have about 1 minute left, literally 1 minute. So I'll let you two decide who's going to take that minute.
Well, I'm just make a comment. We did do that for our central energy hub. We did have a design competition, and a couple of things. One is we are outsourcing the building and operation of that entity for the next 30 years. So we've made that decision. There are some capital benefits, as well as the fact that the technology is so different. And the engineers are calling this the hybrid plus model, which is not the full 100% net zero day one, because the technology there, or the technology available, isn't quite where they want it to be. So we're building in opportunity for some additional investment and expansion to get to that point where we're going to open, before our goals are due, and then have another decade or so to look at new technology and new advancements to get us there, in partnership with our concessionaire that we're going to be directly involved with. So I like the idea of the bake-off. I think it was pretty well received, and we brought in a lot of new ideas that we wouldn't have otherwise been able to capture.
Well, I want to thank you all for your time. We are at time. I would encourage you to speak with our panelists after this if you didn't get your questions answered. And thank you for being here. We enjoyed our time with you.